Imagine you're in Committee Room 14 in the House of Commons, and there's a big hubbub at the back as people stream in the single entrance. That's what we're doing the equivalent of virtually. Okay, I think things have settled down. So let's start formally. Welcome everybody to the latest meeting of the All-Party Parliamentary Group for 1001 Days. I'm Tim Lawton, chair of the group, and nothing could possibly go wrong online this afternoon. We are being well looked after by the Parent Infant Foundation, our secretariat, who've set all this up, so thanks as ever to them. Now, we've got a really interesting, not that we don't always have a really interesting selection of speakers this afternoon, but we've got a lot to get through. We first of all have Jodie Reed from the ISOS partnership, who is going to talk about her Working for Babies report, which has just been published. And there's a really good report with some really meaty stuff from her research about the impact on babies and families during lockdown and lessons that can be learned. Taking questions later on with her will be Natalie Parrish. She's also a director of ISOS, who helped Jodie with the report. So we're going to have a presentation with some slides, I think, from Jodie first of all. We'll then go on to Andrea Ledson, who needs no introduction. Andrea's going to just give her thoughts on the report, her response to that, but also an update on the much-awaited Leadsom review, which we're all very excited about, and a lot of work has been going on behind the scenes, and I'm pleased I've just been a small part of that. But Andrew's going to give us an update on how that review is going, and here's a spoiler: it's going well. And then thirdly, Sarah Newman will be joining us in a little while. Sarah is the Director of Children's Services from the by-borough of Westminster and Kensington and Chelsea. Again, she's going to give some reflections on how they as a local authority have responded to the pandemic, a comment on the report findings, and some suggestions for how the government should be handling this going forward. So there's a lot to cover. We're going to take questions and comments at the end. Now, we have a Q&A specific box. If you would like to raise a question or to make a forceful point, put it in the Q&A section. I will then try and pick up as many of those as I can and field them to the various speakers. If you just want to make a general comment, then use the chat function for that, and you can chat away to your heart's delight on that with anybody else interacting. But if you want me to raise anything, because this is a webinar format, then please put something in the Q&A. We've got until 4:30, so I'll try and take in as many points at the end of that as possible, and then hopefully we can get some comments in from parliamentarians who are part of this webinar as well. So on that basis, the numbers appear still to be going up, so nobody is in the wrong meeting, I hope, on the back of that. So I'm going to hand over first of all to Jodie from the ISOS partnership. Jodie has quite an impressive background in early years experience working with charities, with the DfE, with local authorities and others. She worked as an associate of the Early Intervention Foundation, amongst other things. So, Jodie, you're going to talk to your report. Hopefully the slides are going to go well, and over to you.
Thank you very much, Tim. Now I'm going to try the trick of sharing slides. Let's see. Okay, can you all see them up there?
That's working.
Okay, excellent. So thank you for inviting me here today. I'm going to give you a somewhat whistle-stop tour of the report that was published today. So forgive me if I appear to whiz through some slides. I'm happy, as Tim says, to come back to anything and answer questions at the end. So the project, as has been, oh, can I move my slides? Yep. Yeah. The project, as has been mentioned, was commissioned in July 2020 by the first 1001 Days Movement Secretariat, who are all here today, and delivered by us at ISOS Partnership and funded by Catanac. The aim was rather broad, really, to investigate the impacts of coronavirus crisis on babies in the first 1001 days and their families during Lessons for the Future, and specifically there to look at the impacts of COVID and lockdown on 0 to 2s, to explore the challenges for local systems and services which support them, and to identify the factors which shape local lockdown responses. The big question there really being what made for baby positive responses, i.e. strong responses for babies. The scope of the report, the project was UK-wide. We're interested in all services working with families rather than any specific one in detail. And the focus, and this is a sort of virtue of the timing in which we did the report, the focus was the spring national lockdown of 2020 and its aftermath, so up to around September, though we of course hope that the learning is more widely relevant. In terms of our approach, we use 4 different methods of investigation and analysed them thematically. The first was a rapid review of a very fast evolving literature, and we looked at academic as well as non-academic work. The second was we conducted an online provider survey which canvassed views of 235 service leaders, and this included significant representations from health visiting, from perinatal and infant mental health support services, and from parenting and breastfeeding support services, but there were many, many others. Third, we conducted semi-structured interviews with 10 senior leaders from local authorities and public health, and a couple of national experts with a good local perspective too. And lastly, we ran three deliberative workshops across 4 local authorities with multi-professional groups. And then at the end, we were able to bring all of those findings together thematically. So what did we learn? So whilst the direct harms of COVID-19 itself on babies have been limited, the hidden harms have been significant from lockdown. This diagram highlights the 5 main areas of increased risk of hidden harms from lockdown to babies around the edge. You'll be familiar with these, but none of them are great news. They are in large part driven by negative impacts on parents, but not only, and they are not so different to the risks that children of all ages faced. These risks were experienced unevenly depending on family circumstance and are largely mutually reinforcing. So for example, a baby experiencing less responsive parenting is also more likely to have experienced lack of social interaction and indirect health risks, all meaning that some babies, and in particular those from less advantaged backgrounds, were at much greater risk than others. So interestingly, there is also a fair bit of emerging evidence we found that some of the potential benefits to babies of lockdown, such as more time with parents, reduced likelihood of stillbirth, were less likely to be experienced by those from more disadvantaged families. So here we're coming to some of our survey responses. When we asked leaders about their direct observations within their service, the message was clear that the negative impacts on babies were not only numerous, but they were widespread. You can see here from our survey that 73% of respondents reported that many of the babies they work with were impacted through parental anxiety, stress, or depression affecting bonding and responsive care. That's the bar in orange at the top. In fact, actually 98% told us that at least some of the families they work with were impacted in this way. And moving down the bars, a similar proportion where you can see that a similar proportion of families were impacted by more sedentary behaviour and less stimulation and play, and self-isolation, where parents were unwilling to attend routine appointments or step outside the home. And we've got over 40% reporting that many of the families they work with were impacted by sudden loss of income or food poverty and poorer outcomes due to loss of direct contact with health services. In terms of domestic conflict, child abuse or neglect, 80% actually told us that at least some of the babies they work with had been affected, and 29% here in the graph, represented here in the graph, said it was many. So I would say it seems likely that Ofsted's data on the disproportionate increase in serious incident notifications, which came into the news in November, was a sign of a much wider problem. A clear message that came through was that pregnancy, birth, being in the early months, and to some extent the first 2 years, were an additional risk factor for lockdown harms over and above family background. Babies' specific needs made them particularly vulnerable at this time, and we counted at least 5 different ways in which this occurs. First, their developmental stage made them more susceptible to the environmental changes of lockdown. Second, their heavy dependency on primary caregivers, who in turn were more susceptible than the general population to feelings of lockdown-related isolation and anxiety, which would play into perinatal mental health issues and general parent responsiveness. Third, the fact that babies and their families were more dependent on universal and specialist health services, which became harder to access, which we'll talk about later. And fourth, the high reliance of many families with young babies on forms of social support and informal childcare, which were just not available, such as grandparent care and stay and play groups. And finally, the fact that unlike older children, babies tend not to be routinely seen by services such as childcare and schools. And when they do have needs, these may not have been as easily visible through remote interactions with professionals. So I think the quote here captures this invisibility somewhat. I'll give you a chance to read that. I'd say for all of these reasons, the report argues that babies who were already at risk due to disadvantage could be considered to have been at double jeopardy during lockdown. And just at the moment where babies really needed the support of services, many were heavily depleted. In our survey, half of respondents said that they were not able to continue supporting all the families they usually work with. Remember, these are service leaders. And 18% said that their service ceased to provide support to all or most families. In fact, it's not on this slide, 13.5% told us that their service, only 13.5% told us that their service continued face-to-face contact with all or most families throughout the spring lockdown. And we also know that the majority did not bounce quickly. Certainly that's what they told us in September when we interviewed them. There's just 61%. Sorry, 61% told us they were still a long way off. Where support did continue, the actual offer varied significantly across different types of service, but also across localities. Now, there's quite a lot of detail in the report here on this, but I just used this chart as an example to show you that while nearly all respondents said that their service had adapted to provide support remotely, either by phone or online, around half of those who adapted only did so for some or a few families. So how did this feel on the ground to those leading and delivering services and support for babies? Those we heard from often described the time in terms of change and uncertainty. Some were certainly concerned about the effectiveness and risks of the adaptations they were making, and the stress of making service changes and of delivering a normal service from home was often hard. But as these quotes, I think, convey, many were also energized to find new solutions and ways of connecting. 85% actually told us that they were making changes. They felt they were making changes for reasons of impact, as opposed to someone just telling them to do so or government edict. Many we heard from reported unanticipated benefits, such as new collaborations, more flexible and effective ways of reaching people, and new practice protocols developed at lightning speed they'd never seen before in their lives. To highlight, though, that through all this, there was really a lot of work to do. This chart gives a sense of that, and the number of practical tasks involved in making adaptations. You can see here that 78% told us that they had to adapt, take on new technology platforms. Issuing guidance to professionals was de rigueur. Yeah, in the face of these challenges, the majority of service leaders and frontline staff we heard from did not feel that the national crisis response had been adequate to meet the needs of babies. 78% of survey respondents thought government had not taken necessary action for babies, with a much more favourable opinion of local authority and CCGs. You can see here it's only 42% feeling that they hadn't taken the appropriate action. I'd say as well, a similar picture was reflected in our workshops, where we tested the statement, national policy during the crisis made it harder for local decision makers here to do the right thing for babies, and the vast majority agreed very strongly. So what was behind this? Part of the issue was the weight and pace of national guidance. Sarah, who's coming later, may say more on this. These quotes give a flavour of that. I'm sure that it's not the only sector where this has been an issue. But at the same time, the national crisis response included significant blind spots in relation to babies, which left huge confusion and frustration. So we've got a lot of guidance on the one hand and a sort of sense of there being gaps on the other. Sometimes where this happened, there were it was to do with centrally issued directions unraveling in the face of contradictory advice, for example, about where professionals should continue face-to-face visits or move online. We've had examples of this from doctors, from social workers, perinatal mental health workers. Sometimes it occurred where decisions were left to local discretion, but without consistent framework to assist with those choices, leading to a seeming postcode lottery. And I think that much has been reported on health visitor redeployment here. There's also the issue about partner involvement as lockdown measures eased, and the extent to which hospitals allowed partners to be part of important visits varied massively. And then there were some simple areas of oversight. I don't really know what else to call them. We heard from professionals who felt well informed about how to prioritise and risk assess their contact with older children, but not babies. We heard from frontline workers who felt hampered by lack of guidance on the use of PPE, and from voluntary sector organisations who had been unclear as to whether they could continue their services at all. There's other sort of notable silences. Childminders seem to have been forgotten about for a long time. There's other examples in the report. Sometimes the oversight was funding, the slowness of clarifying support, again, to early years providers being a major issue. So these quotes along the side are fairly typical of the views that we heard, in that they attribute the baby blind spots, we've called them, to long-term lack of focus on babies relative to older age groups, as well as a myopic focus on COVID-related risks above other community risks during this period. It's sort of these two things coming together. So as well as the crisis policy, long-term national policy issues were at play here. And I won't go into detail, but broadly speaking, the issues were fault lines between different national agencies and frameworks relating to 0 to 2s, which caused confusion. We were told that the level of redeployment of health visitors was more to do with the nature of the employer organisation than anything else, reflecting some problems with service fragmentation and complex accountability. And then there were the long-standing funding issues alongside a rising tide of need, which put some services and some areas at weaker starting points when the crisis hit. Children's centres get a special mention in the report here. So that's most of the doom and gloom. Now onto the baby positive local responses. So this is just a term we've used to describe those local responses which really rose to the challenge. And some really did. We were able to define a set of actions and activities which we've termed baby positive, in that they allowed systems to understand which families required support, including families with babies previously not known to the system, provide good access to maintained and adapted services rather than reducing to a bare minimum targeted offer, and ensure that local future 0 to 2 needs would be met by continuing to review and plan ahead, and ensure staff felt supported rather than going into simple crisis management mode. And there's, in the report, there's a lot of detail under all of these about the kinds of actions that were seen in areas doing this, as well as those who did it less well. Most of the most areas put in place at least some baby positive actions. We found 2 local authorities where we felt they'd achieved an overall baby positive response. The report identifies 10 enablers, and these are sort of prior factors, prior conditions that made it more likely that local systems would demonstrate this kind of strong response for babies. They fit into 4 dimensions: strong leadership, mature partnership, dynamic understanding of need, and innovative culture. So I'm going to canter through these. So on strong leadership, local political commitment to the 0 to 2s agenda could pay dividends in terms of direct pressure to maintain services. And we did pick up examples of councillors literally picking up the phone and saying, get that children's centre open. But more often it was through the articulation of a clear commitment and offer to babies and good investment in 0 to 2 services and infrastructure. We heard how this in turn supported good capacity to respond to the crisis, prioritisation of services, and trust in operational leaders to act decisively to make necessary changes. Operational management that was clear-sighted, stable, and well connected to staff at the front line was equally crucial, as it allowed managers and staff to pick up on and respond rapidly to new issues. So the second area, mature partnerships, where these genuinely existed, we often heard about how they endured during the crisis and actually came into their own. Conversely, where partnership arrangements between health and local authorities in particular did not extend meaningfully beyond frontline working relationships, or where partnership structures were not fully embedded in driving decisions and accountability, there could be a tendency toward retrenchment to silos during the crisis. You know, it's a question of who you know and who you phone and what your forum for decision making is. And if it's one within your organization, if that's your first port of call, then that was sort of reinforced by the separation. The strongest strategic partnerships provided a basis for shared understanding of risks, joint planning, and quick resolution of issues at very senior levels. So that was the sort of the senior side, but also on the front line, a close history of working in collaboration across operational delivery and including with the voluntary sector laid the ground for good crisis communications, swift and creative adaptations of services, and effective use of resources. All of these are very much not one thing without the other. They are all part of circle. The third area, dynamic understanding of needs. Areas with systems for sharing live data across agencies about potentially vulnerable families with babies did well. Joint data sharing also allowed local authorities to keep track of new births when birth registrations stopped. Arguably, though, more important than formal systems was a culture of sharing information between staff across and within agencies. Where these sorts of relationships existed, new forums were established quickly for sharing the relevant information for managing during COVID, and informal referrals could be made even as professionals moved online and weren't seeing each other on a regular basis. I would say that locality-based approaches around children's centres and family hubs were particularly good at doing this, so that people knew each other. They were inclined to pick up the phone. Areas with a history of co-production with a voluntary sector and parents also reported that their community connections meant that they could reach deep and pick up on information about families becoming vulnerable virtually in real time, and reach out to those families using trusted peers and professionals. And finally, a well-embedded innovative culture serves services well. And so this was partly about good prior tech, though you won't be surprised to hear that I didn't come across a single person who thought their technology had been adequate at the start of the crisis. It was partly about having staff with the experience to problem solve through reviewing and improving systems and having the trust of managers to make changes. So where that was the norm in an organization, for even staff at sort of more junior levels to look at issues in a systematic way and make changes, that was a strength. And it was also about having established networks for learning and reviewing with peers. And we had in particular examples of regional networks across Wales, actually, but also within regions in England, where that opportunity to knock heads together and say, well, what does this piece of government guidance say, and what did this action tell us, and did we do the right thing here? It's enabled people to feel more confident in the decisions they were taking, less drowned by the weight of government advice, which was sometimes conflicting, and just more confident to go forward and to take the positives out of what was happening and learn those and think about how to systematize those. All of those things were assets. So just to sort of finish off about what this all means for the future, the report ends by looking ahead to 2021 and post-pandemic. And it's clear that 0 to 2 services are likely to face increased need and harsher financial times. And they will have to rise to these challenges while managing a quite real threat of workforce burnout. So a lot's been said about workforce burnout, and not so much in the sort of baby sector specifically. The report's got some quotes and insights there. It's definitely a real thing, and definitely there's a sense that the energy that was there and the sort of adrenaline, if you like, was starting to subside when we finished our interviews in the autumn. And they're also going to have to resist the temptation to roll out changes without proper evidence. And I'm thinking particularly of putting things online, which might be attractive to do when finances are tight. We saw lots of pros and cons. Again, the report includes a lot of detail about how professionals viewed both the positives and the negatives of moving things online, and they need to think really carefully and evaluate changes before moving forward. Yet, despite all that, there are opportunities and there is real momentum. So there's opportunities to build on newfound strengths and create a stronger offer of support for babies. As I've mentioned, the crisis catalyzed some local advances, for example, around understanding of families, better use of virtual technology, and the forging of new local partnerships and collaborations. And there are also, of course, wider opportunities to learn lessons from the experience by doubling down to ensure that the system enablers I've listed here are strongly present in every area. So I think there's there's questions for national policymakers there as well as local. And in particular, I'll just sort of leave you with this quote. I think this is from towards the end of the report. There's an opportunity to take a lesson about human connection and think about how we nurture strong human connections across agencies, between areas, across staff, working at different levels, and with communities, because those that had these things in place seem to be more resilient than other areas and best placed to serve the needs of babies. So thank you.
Jodie, thank you very much. That's a very comprehensive presentation. Just to answer the question somebody posed earlier, the slides will be made available as well, and everybody should have had access to the report. I mean, there's some depressing stuff in there. Certainly the first part of your presentation was. Alas, a lot of it doesn't come as a great surprise in terms of where the weaknesses have been. It's good though that you've ended on some positives, and the new strengths section at the end of the report I think is particularly interesting, Jodie, as you just said, about enhancing understanding of families who may need support, the use of technology going forward, which is not a substitute for face-to-face contact, but it's a way of enhancing and filling in some of those gaps, and also how important that multi-agency collaboration is. And you notice it when it's not there, but you appreciate it when it clearly was there and really came to its fore during the pressures of the last few months. Right, some really interesting, very thorough presentation there. So we're going to come back with questions to Jodie at the end of it. But I want to go on now to Andrea, just to give her initial 3 pennies worth on the report, but then also to talk in a little more detail about the state of the lesson review. Andrea.
Thanks very much, Tim, and great to see you all there. I am absolutely overwhelmed by the superb level of detail and insight that you've got in that report. That is incredibly helpful for my review. And the reason I'm particularly overwhelmed is because it chimes totally with the evidence that we took. So the one thing I would say is that we've seen evidence that things have been significantly better in the latter part of last year, when the sort of second and then the third lockdowns happened, because staff were not moved away as much as they had been in the first lockdown. So I do hope and think that actually it was a tsunami of, nobody knew what was going on. It was all incredibly difficult. People were trying to do the best they could without even knowing what PPE was necessary, whether there was a risk to the lives of babies and so on, if you recall back to last March. But certainly now, in more recent weeks, people have been saying that it all feels much more manageable, and that the lessons learned are indeed very valuable lessons. So I guess the first thing I would just like to reflect is what amazing work was done by early years professionals in that first part of the lockdown. And for many of them, it was so difficult, literally batting around in the dark without enough advice or with too much advice and so on. So I think we should say a huge thank you, since we are the all-party group for conception to age 2, to everybody who's done so much to support new families in such a difficult period, and to really, I think, reassure them also that we are going to learn those lessons. And the review that I'm chairing, although it predates the pandemic, in fact, it really first started in the summer of 2018 under Theresa May's premiership. And a lot of research was done during the year summer 2018 to summer 2019. And then we changed leader, and Boris reappointed me as early years healthy development advisor in July last year. So it has been a continuum. So in a way, the evidence that we've taken as this early years review was a big slug of evidence prior to the pandemic even being in anybody's radar, all the way through the first terrible lockdown, which was so devastating, and now through to the end of it, where people have learnt lessons and have really started to think about the opportunities. And I'm so glad, Jodie, that you did focus on some of the positives, because there have been a number of them. And certainly the one thing I would highlight is the fact that professionals were very clear that for many of them, it was a great opportunity to be able to meet colleagues, to discuss a particular family in a much more fleet of foot way. Whereas in the past, you would check diaries, you might organise a meeting in 3 weeks' time, and then someone pulls out, so it gets rescheduled for 4 weeks' time, etc., etc. Whereas now, during the pandemic, people have very much got used to this kind of call. Let's meet 2 o'clock this afternoon, all right with you? And suddenly everybody's convened and able to provide that speedy support. So I do think one of the ways in which the pandemic lessons learned has influenced my review is to illustrate that whilst absolutely right to say place-based is key, and I'll come back to that, but nevertheless, nobody, parents, professionals, nobody, voluntary sector and so on, wants the opportunity of digital and online support and the sort of amplification of the ability for professionals to work better, for parents to get quick answers to things rather than having to sort of go down to the local GP surgery or whatever. So I think digital has come into its own, and that has been one of the things that we can use to a good advantage. But the other thing I think is great is that your review really does reflect that the 4 areas that you talk about really do reflect the recommendations that are emerging from my review. We will actually have 6 areas of recommendations. And the first one is about place and the delivery of the offer to families. And a lot of the evidence that we've taken demonstrates that for families, sadly, at the moment, the only person who joins up the services is you. And if you've just had a baby, you don't know what you need, let alone what's out there. And so there really isn't nearly enough signposting and support for you to be able to see what's out there and get access to it without a real challenging calling round and going on Mumsnet and asking neighbours for advice and so on and so on. That's just not good enough. So a joined up offer to families in the period from conception to the age of 2 that also takes account of different demographics. So we did virtual visits all around England. So we've been to sort of rural Devon and to central Manchester and all places in between. We've seen some excellent practice and some which really doesn't bear talking about. But certainly the difference between rural communities and the problem of trying to get on a bus with a toddler and a new baby if it's a 30-mile round trip to a children's centre versus the opportunities in downtown places to actually be there with other people and be able to get the support that you need. So first of all, place. So family centres, spokes in reaching out to rural communities through perhaps libraries or village halls or churches or whatever it might be, and also the virtual hubs to provide the virtual support when you need it. So that's the first thing, is place-based and a very clear offer that families will be able to count on. The second recommendation then is about the actual way in which the support is provided to families. And here, digital, it seems that there's two aspects to this. One is that parents at the moment don't own their own data. So you meet a midwife and she or he will take notes copiously and stick them in a filing cupboard. Then you meet a health visitor and she or he will take notes again, start again, and put them in a filing cupboard. Not always, but in most cases. So actually providing the join up so that families have access to their own data, but so too do professionals, is really, really important. And secondly, in the area of digital, is the whole idea of actually providing some advice and signposting to parents on what is good online advice. So as everyone with an interest in the early years knows, it's a huge space and there's some brilliant voluntary and charitable work that goes on in the early years sector. But for parents, again, if it's your first baby, you don't know what's good, what's bad, what's rubbish, what's really worth listening to, and so on. So actually making some sense of it and providing signposting. So I think there's a big piece of work on digital that will form a part of our recommendations. Next, I think, is, as you've also pointed out, Jodie, is the leadership. And so our recommendations will be looking at how the both national and local leadership could be so much better to provide the join up within both at national government level to ensure that there is proper ownership of the early years space and leadership of the early years space, but also at a local level to make sure that the Director of Children's Services is working with the Director of Health or Public Health, or with the health visiting body, or with the social workers. So that's the areas of recommendations that my report is coming up with. And I think what's incredibly reassuring to me and helpful to my review is that we don't disagree with anything you've said. We don't disagree with your findings. We don't disagree with the negative aspects. It has been devastating for new families. There's no doubt about that. There's going to be a lot to be done. We've heard a lot about how babies themselves, who we know are born to be little sociable creatures, and if all they've seen is mum and dad, or just mum in the first few months of life, then actually meeting granny or a neighbour's child is absolutely terrifying. And actually, you know, we need to, and we will discover in the fullness of time what the impact has been on babies and very young children of so little social contact. We know it's a bad thing, but we don't know how it will pan out, and we don't know whether there are steps that can and should be taken to try and make it right. But certainly to ensure that families in the future benefit from the experiences of lockdown, and that we tackle some of the awful things that have happened, is absolutely going to be at the heart of the early years review. So I'll stop there, because as you'll appreciate, whilst we're pulling all our recommendations together, today is not the moment for the launch of the review. That will be in late February. And between now and then, we are working very closely with cross-government to ensure that all different government departments are signed up to the recommendations. And then at the end of February, having got the government's agreement to the proposals, and certainly it's the intention of those of us, I see some of the faces and names on this call, in the cross-party, cross-house advisory group to this review, we all hope that it will not only be totally sponsored by government, but also accepted and approved by every other political party, so that this early years review will be the one that sticks and endures for many, many years to come. So thank you. That was a fascinating report. It chimes with what we're doing, and we really look forward to being able to give you all the final report at the end of February. Thanks.
Andrea, great. Thank you very much for that. And I'm sure there'll be some more questions about the way forward when we come to the end of the presentations. But the third and final presentation is going to be from Sarah Newman, the Director for Children's Services at Westminster and KNC, who has joined us despite a bit of technology challenges, I believe. So you're just going to sort of reflect on some comments on the report, and then really the view from the front line and the people that you are responsible for on the front line in those two boroughs, and how they've got through the pandemic, and some recommendations, perhaps, and comments on how the government should be going forward on this. Over to you.
Yes, thanks very much, Tim, and absolutely delighted to be here today. I'm Sarah Newman. I'm the Director of Children's Services for, as you say, Westminster and Kensington and Chelsea. And I've actually led a number of peer reviews on behalf of the LGA for the early years. I'm a firm believer that if we get this area of work right, we really are giving children the best start on which to build their future. But interestingly, I think it's the most challenging area that we work in. These are the most vulnerable children. They're totally reliant on their caregivers. Their caregivers' circumstances are absolutely key in terms of their health, their income, the environment they're living in. And it's absolutely so important that they have access to the right support at the right time. And, you know, the reality is that the join up across health, education and social care isn't always as good as it ought to be. And the government guidance that exists actually isn't always helpful in bringing those three key agencies together, because we all know there's a slightly different lens depending on which glasses you've got on, whether you're a health professional or an education professional. So I think there is a real opportunity to look at the guidance in this area in terms of Best Start, Healthy Child, and the whole early years framework, the foundation stage, and really thinking about how it comes together. I think there's a massive opportunity here for mandating the 2-year-old check, but I'll come back to that, because I think this area of work isn't always given the priority that it deserves. In relation to the Working for Babies report, I absolutely agree with the recommendations. I think that for the 0 to 2-year-olds, there's absolutely an additional risk as a result of lockdown, and that often it does create a blind spot for services and policymakers, because we were thinking about the direct impact of COVID and not always the indirect impact in terms of that exposure to trauma, the social isolation, parental poor health, poor environments, and actually just living in poverty. I absolutely support the 10 enablers to a baby positive response. I thought that was very interesting. Locally, we had just graduated from the Early Intervention Foundation, I'll get this right, Early Years Transformation Academy. And actually, that put us in a really good position of having a lot of political support for early years, and also a lot of support from senior leaders across the whole children's system. We had also just spoken to about 400 parents across Westminster and Kensington and Chelsea about what they appreciated in terms of what services provide for early years, and actually what they thought we could do better. And really interesting, Andrea, a lot came out about digital platforms and how they could make better use of group apps that young mums particularly, and new mums could actually make use of, and feel like they were supporting each other rather than always relying on that professional support. when we, sorry, I should say that locally, we've invested quite a lot in systemic practice, which is all about relational approaches. So Jodie, that last slide about building connections really sort of resonated with me, because when we went into lockdown, we were really thinking, how do we retain relationships with people who were going into isolation? And a big thing for us was recognizing that a lot of services were moving to digital platforms. It was making sure that vulnerable families had access to the technology to be able to maintain that connection to us. So we were very quick to reach out to all of our vulnerable families to make sure they had access to digital devices and access to the internet so that we could retain contact with them. We also thought it was really important that we had safe spaces for us to see vulnerable families face to face, and that was across the whole system. So for midwives who needed to talk to a new parent, either during pregnancy or just after birth, that safe space was really key, particularly if there were domestic abuse issues that actually you can't always pick up on through a digital environment. But also we had safe spaces for our social workers to see families face to face, and some of our early help practitioners. We made sure that we had contact. We made contact with every new mum. We sent them new birth packs, but most importantly, we made sure that every new mum had a link worker so that they knew who they could contact if they needed advice about anything. We also sent out well-being packs for parents. You know, parenting's hard at the best of times. Actually, when things get tough, parenting can be really, really tough. And actually parenting on your own or parenting when you feel isolated is especially tough. So making sure that parents knew who they could contact, knew who they could reach out to, felt really, really important. And we increased our contact. So if we were in contact with families using digital platforms, we were also making sure that we were in telephone contact with them as well, so that they knew that we were always there for them. And that just felt very important. But I guess the interesting bit for us working in children's system, in children's services, was that a lot of emphasis was put on vulnerable children and vulnerable families. And from a social care perspective, my background is social work, you know, actually making sure that for all the most vulnerable, we have the relevant support in place, absolutely important. But how about all those children who weren't known to social care, who actually weren't prioritised for a school placement because they weren't already considered vulnerable? How about for those children who became vulnerable during lockdown? Because for them, they were invisible. So that idea of that baby blind spot feels for me even more important given the vulnerability of our very, very young children. So I guess if I was going to make a couple of wishes, absolutely that developmental check at 24 months becoming mandatory, that would feel very important. Greater flexibility in the Healthy Child programme in terms of who can do what, when and how. Does it need to be a health visitor? Could it be an early years practitioner? Could it be a nurse practitioner? And then that joining up of Best Start, Healthy Child and School Readiness initiatives. The new early years framework goes some way to doing that, but my view is that it could go further. So thank you, that's probably enough from me.
Sarah, thank you for that really interesting points in that, certainly around the use of technology and those platforms. It was really interesting. I heard from certain authorities where they were still able to send out social workers to deal with problematic families in particular, but of course that was quite rare. So there were many using mobile or devices to have interviews with families, but also making them take the devices around the house, literally to look in the fridge and things like that, which you might do if you were visiting a family and had some difficult questions, but making sure it was a thorough, not just a token face-to-screen visit in that case. So some quite interesting innovatory work in some places has been forced out because of the circumstances we find ourselves in. It's a question of how that can be used in normal times to enhance best practice as well going forward. Right, now, we have got just over half an hour left for some questions and discussion. Now, talking of technology, we are trying to juggle not only question and answers posed on here, but we've also been live streaming on YouTube through the magic of science. And we actually have some comments from the live stream on YouTube, which have come to me by my mobile device. So I'm going to start with one there just to show that we are listening to you, listening to us. But somebody on YouTube, and this is really one for you, Jodie, and about the report, has asked, was there a focus at all on BME families who've been disproportionately represented in infection rates and sadly fatalities as well? So was that a particular consideration in the report, or was that for a separate piece of work perhaps?
So we did pick up on the additional, I mean, they were within the groups of people who were more likely, certain ethnic minority groups were more likely to feel stressed and more likely to feel isolated. So we picked up on the evidence there largely from the Babies in Lockdown report, which the Parent Infant Foundation, Home Start and others produced in the summer, which gave some quite interesting indicators of the sort of differences in pressure felt across families with young children from different Black and ethnic minority backgrounds. I don't know if Sal wants to add to that or...
Okay, Sally Hogg, who's from PIF and is part of the secretariat to the group. Sally, do you want to answer that?
Yeah, so I mean, so Babies in Lockdown found, as Jodie said, that particular groups, including families from some Black, Asian and minority ethnic communities, were more likely to have concerns during the pandemic, and also less likely to feel comfortable accessing services or to have contact with services. And there was really this message through Babies in Lockdown, which again is in Jodie's report, of the fact that families who were already at greater risk or more vulnerable, that might be because of very low income, because they were young, because they were from a Black, Asian or minority ethnic community, had this kind of increased risk. They were at increased risk before the pandemic, and then they were more likely to have a difficult time during the pandemic. And so we're really worried about the widening of inequalities there. Of course, also there were higher risks of COVID and of the impact of COVID for families from those communities, and that was highlighted in the Embrace report.
Can I add, Tim?
Yes, Andrea, sorry, yeah.
Thank you. Can I just add, yes, in my review, we had a very interesting round table with Black mums and another one with South Asian mums. And there was this real sense that that people on the call didn't feel they'd been listened to. So it was this real problem that not only were there a lack of services, but also people weren't really listening to them. So when they had real, whether it was health issues or mental health issues, there was a feeling that they just simply couldn't be heard. And I think that that's something we want to come back to in the review. Thanks.
And Sarah, you've got a very multicultural range of families in your two boroughs in particular. Have you had to make allowances and different approaches during the pandemic to how you look after them?
So it's been absolutely clear that people from minority ethnic backgrounds have been disproportionately affected by COVID, and that we know that we can struggle as a local authority to reach those communities and for them to have confidence in the services that we're offering. Really fortunate in Westminster and Kensington and Chelsea that our social care staff are pretty representative in terms of ethnicity of the communities that we're serving. And I think that helps to build confidence and trust. We also work with lots of voluntary organisations in order to reach out to the community and to develop a whole range of different services that people can access. So I think through the pandemic, it's been increasingly important to maintain connections and develop really good communication with our voluntary sector services, and to use everyone in the messages that we're getting out to the community.
Following on from that, very conveniently, is a question from Sarah Kingham, who's asked, could there be a process a little like the safeguarding one that allowed or enabled people who visit homes where there are new babies to know what questions to ask and who to feed the info to? And she said that as someone delivering food as a volunteer for the local food bank, and I know that most of the other volunteers feel it's not our business, but as I deliver the food, I'm starting to build up relationships with the recipients. And a couple of the families I deliver to either have babies and toddlers or are expecting them. I mean, that raises some interesting points about if there's a good thing that has come out of this whole pandemic, then it's the huge community efforts and the community hubs and the volunteers of people that have come forward, and people in the same street actually talking to each other for once, having lived side by side for years. And the real challenge is going to be, I know our colleague Danny Kruger has just written a paper on this for the Prime Minister, how we then translate that into peacetime and carry forward some of these great networks and sharing of information and a real community spirit. And on that issue particularly about how we use these volunteers to make that face-to-face contact that perhaps is not happening with professionals. And one reason behind this whole controversy we've had recently about school meals and the food boxes, one of the reasons the schools prefer to use those food boxes in many cases, and in some schools the teachers will actually deliver them too, is to keep that contact with some of the families who've gone off the radar and otherwise they wouldn't see from month to month, and you certainly don't see if you are just issuing them with a computer code for their for vouchers to redeem. So it is another way of keeping people on the radar and keeping an eye out, as well as being there to able to offer some advice. But how do you do that with a volunteer who all the sort of health and safety rules and data confidential goes out of the window? How practically, Sarah, can we actually use that?
Absolutely, and you know, I think the voluntary effort through the pandemic has been wonderful, and certainly in Kensington and Chelsea and Westminster we offered safeguarding training to all our volunteers, and we absolutely wanted to build on that notion of making every contact count. It's really interesting, Tim, what you're saying about schools. Schools have been magnificent in being vehicles for delivering food to families and being a real support for families. In fact, I would think that relationships between schools, particularly between primary schools and families, has really strengthened during this crisis. And certainly what we've realised as local authority workers is that actually we can use the networks that exist to build on those good relationships and get messages out to people. I think it's really raised a good question about, you know, what is the role of public service? And actually, very much in the local authority, what we can do is facilitate connections and not always be the delivery vehicle ourselves. So we can play a great role in providing support that enables other people to build the relationships and maintain those connections.
Yep. Jodie and Andrew, do come in if you want to add any answers. Coming back to an early question, actually, Sarah, again for you, and I think the answer is no. Have children's centres been reopened at all yet? Presumably not now in lockdown, but haven't heard of them reopening at all. She's been involved a lot in getting classes and groups reopened, but had no luck with children centres. That, I presume, is the experience in KNC and Westminster, Sarah.
Yeah, I mean, certainly we've been looking at the offer and doing what we can. Much of it has been online. When the lockdown measures relaxed, lots of work went back to face-to-face contact. and then it moved back to digital platforms when we moved into this lockdown. But we're constantly looking at what can we provide that's safe to do so, and supporting children and families during these difficult times. I should say all our social work visits have continued to be face-to-face where it's safe to do so.
Right. Yeah, which is pretty impressive given the experience of others at the moment.
Tim,
Jodie, do you want to come in? Yeah.
yes, can I just add that, so I think, as Sarah says, the situation is now that most children's centres will be operating largely on digital platforms, or apart from a few that are reserved for providing very specialist targeted support, usually by appointment only. The situation in autumn was hugely variable, and I would say it was as variable as children's centre provision is. So we saw some areas where centres had been kept shut, and others where the majority were open, albeit with services being managed more carefully. So I think that is an area that we could look to for greater consistency. Linked to that, there's interesting questions about use of volunteers in food bank volunteers. So I was volunteering myself yesterday, and I'm interested in these relationships. And we heard in our research from a number of local authorities who said that food banks had become really important connectors for them. They'd hosted food banks in their children's centres. Sometimes they'd turn their children's centres into food banks, and they were often, again, it's about the pre-existing relationships. So where they'd had those relationships with the voluntary sector organisations providing them, that had happened very effortlessly, that transition into hosting those services. Though even where they hadn't, sometimes those relationships were forged and formed. I would also say that we heard of examples of volunteers already out there doing this kind of advisory work, parent champions who are out there and referring on to services. They had the training, there are models for this, and I think that's something for the next stage of thinking about how we capitalise on this mass movement of volunteering and community support, is how we build on what we've already got in terms of training. Those models have felt quite peripheral at the moment, but they needn't in the future.
Yeah, I would certainly add to that for a very, very long time, I mean, 2013 was the best practice in Sure Start's report when I was chairing the all-party group. And then it was very clear that some of the best practice was those children's centre operations that had developed their voluntary sector. And what they found is that if you were a parent, obviously often the mum, and you'd had postnatal depression and you'd been effectively supported and upheld by your children's centre, then in a way, as part of your final recovery, you would like to go and help other parents. And that actually has been a real sort of virtuous circle for many children's centres. And certainly in the review that I'm doing, we've heard time and again how, for example, breastfeeding support. We've got terrible rates of breastfeeding across the UK, the lowest in Western Europe. And we know it's incredibly good, solves obesity issues, health issues, bonding issues, and so on and so on. And yet very often people don't feel, it's sort of like it's personal, it's embarrassing. And so very often someone who says, oh gosh, yes, I had such trouble latching on here, let me show you how I did it. So as somebody who is like a peer breastfeeding supporter is so much more welcome. So in a way, certainly what we'll be recommending in our review is that the co-commissioning must include the voluntary sector. You can't simply say, yes, the state will provide, because actually there are certain things that leads to stigma, for example, if it's provided by the state, that doesn't if it's provided by the voluntary sector. So the fact that we have such goodwill amongst volunteers, so many people who want to help and volunteer, we just need to bring that all together.
Tim, if I could just come in very quickly on the children's centre point. I think it's also worth remembering, as Jodie said, it was very variable in the autumn in terms of how they were used and what was open. But I think it's worth remembering that during the pandemic, the physical spaces that children's centres offered provided a new and different dimension, I think, in some local authorities. And I can think of a number of examples where services that had to be delivered face-to-face that might previously have been done in clinics or in spaces that were not accessible to the community during the pandemic, moved into children's centre spaces. So it was putting it right on the doorstep of parents. And I think that was something that was really valued. The other example that really stuck in my head from some of the review interviews we did was an example in an inner city area of opening up the children's centre gardens and outdoor spaces and play spaces to families in the vicinity that didn't have access to outside space themselves. And that, I think, was seen as an absolute godsend by those families who were able to play outside in a safe place. So I think it's worth remembering the physical aspect of children's centres, as well as the many fantastic services and in-person work that they do.
Thank you, Natalie. Now we've got loads of comments coming up on the chat. Invariably, one from Cheryl Adams about health visitors. It wouldn't be a 1001 Days meeting without Cheryl talking about health visitors quite rightly. Also, somebody said that children's centres are open in Richmond and Kingston, offering health services and face-to-face support for vulnerable families. Now I've got various questions. Another one from YouTube, just to show I'm across all these technologies. What good methods of blended digital face-to-face approaches were found in the research? Jodie, do you want to respond to that?
Yes, I mean, lots of people talked about it. It was largely not blended. It was largely fully online, and people were talking more about how through this they felt like they'd gone from one extreme to the other. And the way forward they saw was through a more blended model. And we heard, in detail about good practice from perinatal mental health workers, for example, or breastfeeding support services, where they had found new opportunities to engage people who perhaps would normally find it be reluctant to turn up to a children's centre or a clinic. Who knew mums, for example, who were in that kind of fuzz you're in when they didn't know whether it was night or day, and finding a moment when the baby's awake and ready to feed, and all of that was really difficult, actually were more found online support more conducive to sort of learning and being helped. However, it was really variable, and that's why I think most professionals said that they needed to develop a model where they had discretion to use it where it worked and where it didn't, and they also needed to lots of people saying that it just needed to be evaluated more before fully online models were rolled out, because I mean it was variable, I would say, by the individual as well as by the type of individual and by the type of service being provided.
Thanks, Jodie. Right, I've got a couple to come back to Andrea with. First of all, how will Andrea's review link up with the recently launched Children's Social Care Review, especially in regards to women who have had babies removed from their care repeatedly, and where it has seemed that the focus is more on repeated, extensive, fragmented parenting assessments rather than relationship-based effective support for parents at risk of removal of their babies? And also an earlier one for Andrea was about funding. Is the review recommending increased resources for babies, or are the changes called for expected to happen within existing budgets? Andrea, do you want to comment on those two?
So two quite challenging questions then. So in the first one, the review is the ambition of the review is to ensure every baby gets the best start in life. Now we know that that is simply not the case, and at the sharp end it's absolutely appalling and babies get taken away, and quite rightly. However, the focus has been all the way through on prevention. How can we ensure that babies do get the best start in life? And we know that there are some interventions. We know health visitors do a fantastic job. We know that parent-infant psychotherapy can really turn around the outcomes for parents and their babies, and potentially with a second or third infant, that possibly parents can learn from the first experience. So this is very optimistic and hopeful, but nevertheless, we are actually talking with the Home Office, in fact, in the next few days, about how to align with their work on safeguarding and prevention. So to make sure that, in effect, we're optimistic but not naive in terms of what we're recommending. But essentially, we want to be very carefully aligned to the work that's going on elsewhere in government. To the other question about resources, we did originally, cards on the table, we started off with a relatively big bid, which really came from the 2018-19 review that I had chaired, which had done a sort of fully worked up bid for funding. But as everybody will recall, this year's comprehensive spending review was sort of effectively a rollover of 1 year. So what we're planning to do is to make the recommendations for change, and then during this financial year 2021-22 is to work through the implementation to get the changes to happen. So to provide funding for some things that need to happen, for example, on improvements to digital, on improvements to some of the work that needs to be done to link things up better so that the family offer is better and is there. And then, as everybody knows, there are big issues with the funding of health visitors. We've got the fact that the 5 minimum visits has now become the 5 maximum visits as well. We know that there's not nearly enough mental health support for parents in the perinatal period. We know there's not nearly enough support for substance misuse reduction, for breastfeeding support, for domestic violence interventions, and so on and so on. So all of those things will form part of the second phase of this review. But again, I don't want to jump the gun. This is going to government right round. So this is, I'm sort of telling you what's in my mind as the next step, as opposed to this is absolutely, crystal clear what's going to happen. But I hope those are sort of very honest and frank answers to the questions, as much as I can provide right now.
Thanks, Andrea. Now we've got a number of other questions, some of which are sort of points masquerading as questions. So I'm just going to read out a few, and then if anybody wants to pick and choose as to what they want to take. One from Claire Castell. We are a digital platform, Blossom Antenatal, started in response to the pandemic, and they've supported over 25,000 parents since March in online classes, which has been very valued by a lot of parents. We'd like to be involved in the conversations alongside our growing community, and our reach is across the country, although we're based in London. How can local digital initiatives be linked into national services? And I guess that goes back, Sarah, to what you were saying about how we use volunteers and communities as well, and how we can use local digital platforms to link up. And then there's another one from Lorraine Klugman. Technology helps this work, and these talks have been impressive. Can we also emphasize the personal when we think about the very focus of working with and supporting babies, the vital focus, essential importance of the baby's mother, father's, carer's touch for the mental health of the baby and of the parent or carer, something we've all suffered without for the last year. This is the great attachment strength. Anybody want to pick up on either of those points there?
Oh, yeah.
Well, I'll just. Sorry.
So you go first,
Sarah.
then Jodie. Yeah, Sarah, then Jodie.
We're jumping in on that one. A great point. I mean, absolutely. Very vulnerable children, totally reliant on their caregivers, and that attachment that is built between them is absolutely key. And certainly, work in the area of supporting caregivers to develop that attachment. Really, really vital.
Yeah, I was exactly the same. I was going to say the purpose of this review is to put the baby at the heart of it, is to look at, rather than what suits the service provider, it's what does the baby need and the baby's parents as its advocate, and then how can we join things up better to provide that support that baby needs, whoever he or she is.
Jodie or Natalie, did you want to add anything?
Well, I just add, in terms of further sort of research questions, I think it would be helpful if we could understand in greater depth the exact impact of lockdown on parents. So I listed some of the impacts and what we picked up from the literature emerging, and there was a very strong message there that responsive parenting has been impacted, and that will have a knock-on for attachment. But I would ask if there's any researchers out there to do some further work on this and to look at parents becoming new parents for the first time in the next few months, and the sort of long-term impacts of having gone through isolation, and whether that has any the repercussions in terms of mental health effects, and they're sort of used to being separate and isolated, whether that has any inhibiting effects on our parenting in the future.
Thanks, Jodie. Right, I'm going to read a couple more points out on the chat. So one from Sarah Kingham. I've had the safeguarding training. However, read this question. It's not that I'm saying they're struggling with their babies, but they are requesting food. They may already be in the system, but they may not. It's that info, which must mean that there's an element of struggle. Could someone suggest some useful questions which could be posed? So safeguarding is more about reporting something you are concerned about. And then Sarah McMullen, I was really glad to see a focus on the important role of partnership working in collaboration with the voluntary sector. Volunteers can contribute hugely to increase community connectedness, reduce isolation, improve access to services, etc. But it needs the infrastructure around them so that volunteer-led services are safe and effective. We have strong models for this, but it takes investment. How can we make sure public health budgets are protected and are able to invest in sustainable partnerships with voluntary organizations? Well, there's another $64,000 question. Do you want to take that one first, Andrea?
Well, I would certainly agree that there's a lot of very good methods for, in effect, supporting volunteers to do a fantastic job. So there's a lot of peer training work that goes on in local authorities for volunteers, whether it's in, mental health support for families, through things like Home Start, through things like peer breastfeeding support, all kinds of things that already go on that actually do obviously cost money and take time commitment, but then do massively enhance the level of available resource to a local authority to help parents. To the point about how do we protect the budget, I mean, that is, everybody on this call knows where we are with the pandemic. Everybody knows the situation with public finances. And I think all I can really say about that is that the Prime Minister is totally committed to this review that I'm chairing. He said on a number of occasions very publicly, last in PMQs last week, how interested and committed he is to it and how much he looks forward to the recommendations. So, I mean, budgets are, they're always a tricky thing, but there are ways. I mean, we've done a lot of thinking about how to not really do more for less, but actually how to get the best out of what we already have. So we do already have many superb, diverse workforces. And if they could communicate better, if they weren't having to sort of keep going back to square one and asking the same old questions of a parent, if there was some continuity, if the parent felt better able to ask for what they needed because they had better signposting, then you might actually start to be able to get greater productivity out of what you already have. But again, I don't want to suggest in any way that there's no more money needed, because there clearly is. Thanks.
Anybody else want to comment on that? I might just throw in my own three penny worth. I remember when I was a children's minister, and I spent the first summer, I spent a week out being a social worker up in part of Manchester, and I went out with the social workers every day. And the very first house I was taken to, and I think they deliberately chosen it, it was in the pretty scruffiest part of the scruffiest part, and it was a really rundown house. And there was this single mum with three young boys living in pretty desperate circumstances. And what was really interesting about that is no end of people had gone into that house and had interviewed that mum, from health, from social care, from education, whatever. There was no lack of professional support, but it wasn't joined up, and she was still in a desperate situation. And as Andrea said, every new person that went in through the door, she had to start her story all over again. Whereas what it really needed was some key person, and the social worker, who was a brilliant social worker that I was out with, was going to be that person, just needed to sort of pick her up and take control of her life and her kids' life for a short time and get her back on track. So to make sure she got down to the children's centre to get the parenting classes, to get one of her sons to the dentist who'd been having problems with his teeth for weeks and weeks and done nothing about it. But somebody who had all the notes, all the info, who could have picked up that baton from everybody else and then just holistically come up with a solution. But so much is wasted because every single person starts the whole story again, and it feels so frustrating for the mum. But it's just a very inefficient way of running a system as well, which hopefully is what the Ledson review is all about, of bringing together all these interested parties. Right, we've got a few minutes left. I've got a couple more points here I might just raise, and I'll come to you, Sarah. Congratulations on a brilliant report, and great to hear support from Andrea and Sarah. Could the 1001 Days all-party group support amending the domestic abuse bill to clarify that children affected by it included babies, included unborn babies? It would be a fantastic first win to make sure there's no baby blind spot in this important legislation. And that's a really good point, because obviously we won the recognition of the impact of domestic abuse on children, which was added to the bill, which many of us raised, but it does go further than that. I don't know if anyone wants to pick up that point. And the second one is, how do new parents know about these open provisions? Using the garden of Children's Centre is amazing if they aren't able to see their health visitors, etc. I work with thousands of new parents across the UK, and all I'd heard is that children's centres are shut. Are we sure this message is getting through to new parents? That's from Emily Tredgett. Sarah, do you want to pick up any final comments? And as we're about to run out of time, any final points you want to round up with as well?
Sure. I mean, yeah, I mean, I think curiosity and connections, I think, are really coming up today. And so the person who made the point about volunteering, you know, actually for me, it's all about how you make connections and build relationships. And it's the simple questions that are always the best. How are you? Is there anything you're struggling with? Is there anything else that I could be helpful with? And it's about noticing as well what's going on. Oh, it's really nice to see you today. I noticed that, in order to start developing those conversations. And that feels really, really important. I think, Tim, I've actually now forgotten the other two questions that came up.
The last point was about how do parents know about these open provisions if they aren't able to see their health visitors and so on.
So hopefully every new parent has a new parent contact where there will be someone talking to them about services in their area. Most local areas now have information on some form of website. Their council website should provide a link to family services, children's services, family hubs, children's centres, and that's always worth checking. In the event that no sort of searching brings a light on anything, my advice is email your Director of Children's Services, whose details will be on the internet, and they will be able to put you in touch with the right support.
Thanks, so your colleagues are going to love you for that. Right, Jody. Yeah, Jody, Natalie.
Not sure if your inbox is going to love you for that, Sarah. Yeah, so I mean, just to pick up on that very last point, it is entirely possible that there are no children's centres with outside spaces available to you in your area, and I think this is an example of how we saw, you know, it was to an extent 1,000 flowers bloom during lockdown, and we have seen very different local practices. I can tell you that the area where that Natalie mentioned, where we did that interview, parents were very well informed and were able to book a slot themselves in the garden. But I think it really points out the need to start sharing the practice that took place at this extraordinary time, and the report starts to do that. But I think there are, I mean, perhaps I noticed there's someone on here from the LGA, and there'll be many others with sort of national networks. There are some brilliant ideas, some brilliant sort of professional innovations, some entirely new ways of working, some people who've shown that things that they had long thought were impossible were actually possible. Yeah, I think your question points to the need to start sharing that more, perhaps developing a bank of it somewhere, maybe LGA. Okay, thank you.
There's a challenge for somebody to take up. So a thoughts, good ideas bank. Natalie, do you want to add?
Just I suppose just one last point, circling back again to the discussion on budgets. I think it's just worth noting, and you know, everyone will be really aware of this, that very many of the sort of really exciting initiatives that we've heard about today, the innovative things that local areas and voluntary sector partners have been doing, are funded from bits of services that are not statutory. And I think the issue that many local areas have is that when their budgets come under pressure, they end up having to preserve the statutory services at the expense of not statutory services. And so I do think one of the kind of real priorities here is to think about, as local budgets inevitably will come under pressure in the future, how collectively do we make the case for the investment in the non-statutory bits that are absolutely essential in terms of giving children the best start in life?
Yeah.
Thanks, Natalie. Andrew, I'm going to give the last word to you. Now, when we have our next meeting in the spring term, hopefully at that stage there will have been great plaudits because your review will have been published. The government has adopted everything as policy and is at pace getting on with implementing it. So we're looking forward to having you back to be able to confirm all of that and exactly what was in it. Are we being too optimistic?
I am so looking forward to that day, Tim, as you well know. And I completely agree with what Natalie said. That was certainly one of the big challenges put to us many times, is because these are not statutory requirements, it's difficult to preserve them when budgets are under pressure. So I totally agree with you and I completely get that. So actually, I'm just going to finish with a plea to all of you. What will make my review stick is if everybody signs up to it. So that means cross-party, and the lovely Sharon Hodgson, who's been part of this, and Lord Russell, and Alison Thewlis, who's been certainly party to the Westminster Hall debate that I held. I mean, right across parties, the Liberal Democrats are also very keen. We need to join forces, and we also need all of those bodies that you on this call represent to sign up to the early years review. Now, obviously, you're not going to sign up to it till you see it, but when you do see it, if you can somehow provide your endorsement, just say, yes, I totally wholeheartedly support this, that will really help me, because, you know, we're trying to, in a sense, carve out much, much more focus on that perinatal period at a time when things are under pressure. But all of us on this call know that actually we will save money down the line by investing in giving every baby the best start in life, so that they end up with the emotional capacity and the lifelong well-being to be able to make a good life for themselves. So that is a sort of cheery note, but a plea for your support and your help when the time comes. Thanks very much, Tim.
Andrea, thank you. And of course, it was a feature of the 1001 Days manifesto when it was first put together and launched by Andrea back in, 2012 now, I think, that it had the sign up of MPs from across all of the parties at Westminster. It had the buy-in of the Royal Medical Colleges, of a huge amount of the children's charities, children's organisation, and it was a real sort of movement, which is what the 1001 Days has become. I think we're all, those of us from different parties on this call and who've been part of the Parliamentary Advisory Group for the review and beyond, are doing our bit to try and get a parliamentary consensus across the parties, and also with the House of Lords and the House of Commons, of signing up to something that we can all get behind, and hopefully the government will adopt as many of the recommendations that are going to come out of it as possible. But the way to make sure it happens is for us to put that pressure on to get that consensus, but also, as Andrea says, to make sure that people buy into it locally, because this has to be delivered on a local level. However much we come up with nationally, it's going to be the local deliverers, the local agencies working together, which is the absolutely the bottom line of all of this, that is going to make it a reality as well, as long as we get the money to help fund that. But anyway, very exciting. We're now 4:30 exactly, so we've stuck to time. I'm really grateful to everyone who has taken part. The technology has not failed us. It's been incredible. I hope I've got everybody's question in just about, including those from YouTube. You can go back and see the live recording on YouTube if you've nothing better to do. But I want to thank our main speakers, to Jodie, ably helped by Natalie, who co-authored the reports, Sarah Newman and Andrea Leadsom, and thank you to Sarah and the Parent Foundation for organising this afternoon as the secretariat to the all-party group. So look, I hope that's been interesting. It's a really good report we've been talking about, but there's an even better report coming out in a month or two's time that we'll be talking about at the next meeting. So thank you very much, everybody, for taking a part, and stay safe, everybody.
Thank you.
Thanks.
Thanks, Tim.